I have my setup here for my peel, which I will go over with you in just a moment, but we're going to first put a warm towel onto her chest and bring it onto her face. This is going to remove any makeup or initial oils on her skin. It's also going to be a relaxing part of the facial treatment for her. So while this is resting, I will show you that I've already prepped one cold towel over here. This is how we're going to cool down her skin after we do the peel. So for your peel setup, we're going to have our peels that we need and definitely one cold towel. So you're going to have that ready for you on the side. So we're just going to open this up and wipe off her skin. And I'm going to go straight into the first cleanse and skip the pre-cleanse for today's demonstration. So I have my product in my hand. I'm using the special cleansing gel, taking that product in over the front of my client and doing the spreading motion across the chest. And we're back. So this towel is going to sit on her face while it's removing our secondary cleanser here. So this cleanser would be done after the pre-cleanse, and you're going to choose the cleanser that's best for your client's skin. So today we're going to be doing the Jessner Peel. This is a peel that has a combination of 3 different strong acids. These acids are going to lighten the skin. It's going to help to control oil and also reduce wrinkles. So this is our peel that's going to cause the most heat on the skin and cause potential peeling. Now, I've done this peel on my skin before, and sometimes my face peels and sometimes it does not. So depending upon your cell cycle and what you've been doing to your skin before this facial treatment, meaning what I do with my skin on my skin day and nighttime, will depend upon how this peel is going to work for my skin on that treatment that day. The way we can make this peel go deeper is by doing multiple passes, and I'll show you that in just a moment. So after we're done wiping off this peel, we're going to prep her skin for the peel. The prep is going to be our one-step prep solution. We're going to put this onto gauze or a cotton 4x4 and wipe this all over her face. This is going to remove any oil or product from her skin, and then we're going to be applying the peel onto her face. Okay, so I used the technique where I folded the towel over twice to remove the cleanser completely, but the one-step prep is going to ensure that her skin is completely dry. So I'm going to take my 4x4, I'm just folding it into a square here. You want to make sure that you have enough out so you're never reusing the same square, because you don't want to cross-contaminate the dropper onto your cotton. So you want to have enough of that product out. So I'm going to do 2 full sizes of the dropper onto the cotton here. This isn't going to sting, but I always tell my client what I'm doing because they may be anticipating this being the peel. So I'll say, I'm just prepping your skin right now for the peel. I'm making sure to get this solution everywhere, around the nose, across the lips, under the lip. You can use this to kind of go over the lip area a little bit, but whenever we're doing the peel, we want to make sure that we are not touching the peel to her lip area. I'm going to go ahead and apply my gloves now. Depending upon which peel you're doing, your fingers could also get a peel, so you want to make sure to wear your gloves during the peel process. I have a fan out as part of my prep, this fan is going to be used to cool off her skin. So when the Jessner goes on, it has a strong acid smell and sensation. So this is going to help wave those fumes off of her face, and it's also going to help to alleviate any of that heat that's created. So I'll let the client know that we have this available, and sometimes I'll just actually go ahead and hand it to her so she can fan off her face. Here you go. She can fan off her face whenever she starts feeling that sensation, because I'm obviously going to be busy for just a moment, so you're going to want to have that available for your client. So I'm going to take gauze now. This is different from my 4x4. This is a woven gauze. So this is called woven, your woven 4x4. Non-woven is your straight cotton. So with this gauze, we use it to do our exfoliating services. Because it has a woven texture, it's going to be rougher on the skin. So this automatically is going to give us a deeper peel. So like I was saying, we're going to put the peel onto the gauze here, and I'm going to, with a warning touch and then placing the gauze onto her forehead, I'm going to start a scrubbing motion back and forth on her forehead like this, and then bringing it to the sides of her face and working on the outer portions of her face before I come and do the inner portions of her mouth and around her nose area. That's because these areas here are always going to be more sensitive, so I'm going to put the product there last. So what I'm going to do is get my fresh gauze. I'm going to fold that in half. You can just open up your peel bottle and just completely turn it upside down on top of your gauze. So I'm letting the solution kind of saturate into the gauze there. And when I do my second pass, I'm going to use a fresh gauze and not reuse this one. So I've already prepped my next gauze that I'm going to use, which is right over here. So I'm going to be applying the peel now. So if you want to start fanning your face, you can do that. If somebody had more sensitive skin, I could use the cotton 4x4, which is the non-woven, so that's going to have a less irritating sensation of the cotton rubbing over their skin, so that's an alternative that you can do. Is it starting to get warm?
A little like tingly.
Right, so she's feeling a little bit of tingle sensations. You always want to check in with your client and see how they're doing. Some people will have automatic reactions to the peel, meaning they're going to start breathing heavier, they're going to start scooting around a little bit, just kind of showing signs of discomfort. I can flip my gauze over and use the other side. Okay, so this peel is now going to sit on her skin. Now when I'm looking at her skin right now, I can see a light dermal frosting. The dermal frosting is a condition for the skin when you're peeling it, where once the peel has gone into that cell and basically done its job, the skin will turn white, and that's a good sign. So depending upon the damage on your client's skin, meaning if they have acne, you're going to see it a lot more. If they have skin that definitely needs to peel, it's going to turn really white. So that always happens normally in this area right here, and any place where the client has extra extractions or the cystic like acne. So if you had a client with cystic acne and you just put this peel on top, it'd be a good way to dry out that oil if you're unable to, say, do extractions on that sort of pimple. So you can see that she is now fanning out her skin. I can help her at this point. So how is your skin feeling?
Tight.
Right, so
It's starting to heat up.
Right, so part of the peel process, which is really a beneficial part, is that it makes your skin feel tight. So as soon as we're done peeling the skin today, and definitely by tomorrow and the next day, the skin automatically feels tighter. So the skin will look tighter and feel tighter, and that's part of the skin regeneration process. So those are positive things about her reaction to this peel. Okay. So I'm going to do a second pass, and I'm going to do that second pass, here's the pan again, and I'm going to do that second pass on her forehead where she has the extra wrinkles and on the sides where she has the hyperpigmentation, but I'm not going to do that second pass in the center here where I can see that in this around her mouth area is a little bit red, and I can see that I think that she'll have a fine enough peel. There really isn't a reason to over peel that area. So I'm just going to avoid putting the peel on another pass in that area. You always want to cap up your peel once you're done using it so you don't spill it and it doesn't decompose or what have you. Okay, so I'm starting again on the forehead and I'm applying the peel, watching where it's going. So you can see I'm coming out to the chin, but not close to the lips, and going back towards her ear line. Staying off this fold of her lip here, but definitely getting these areas here where there's that hyperpigmentation. I'm gonna scrub it here a little bit where she has these deeper wrinkles here, because the skin peeling is going to regenerate the skin. I'm also gonna take this gauze and I'm gonna go over her décolleté area, as she does have some hyperpigmentation there and some little oil bumps there as well. So this is gonna help to renew that skin as well. So the client will feel the burning on their skin, but this peel does self-neutralize, meaning that there's going to be a point where it stops doing its job. It's just going to be basically over. So I could use a cold towel and put it on the skin and it's not going to keep peeling. Now I can do processes, which I will do, to calm down the skin, but it's not like a glycolic peel where I have to really care about neutralizing the skin, but I'm going to show you that anyways as well. So with this peel, I applied it with the gauze. With other peels, we can apply it with our fan brush. Our other peels that we have would be a lactic peel, which we have in the multivitamin peel facial. We have the glycolic peel, excuse me. So we're going to be applying those with our fan brush because it's a thicker consistency. With the Jessner peel, it's a more of an alcohol base, so it's very liquidy, so it can't be applied with this because that would be a dangerous application. But with a thicker peel, we can apply it with our fan brush, and I'll apply that all over the skin, normally using 2 fingers to rub it in to make sure it really is going to saturate into her skin, and then we're going to neutralize it. So we first did our one-step prep to prep her skin. After you're done with the peel process, you're going to use your neutralizing solution. So I'm going to use that on her next, over her whole entire face, before I use either the Ultra Calming Cleanser or the pre-cleanse to remove the peel, followed by the cold towel application. So with the neutralizing solution on the 4x4, I'm just going to first do those areas that I said we're going to peel first, where I saw some major redness. This is because these areas are probably most irritated, and this is where she needs to feel relief first.
It's instant.
Good. So this solution is first just put all over the skin, and then I'm going to use a cleanser to really remove this product from her skin. So just like I was saying about the glycolic peel, you'll want to make sure to neutralize the skin and then do a good thorough cleanse with either the Ultra Calming Cleanser or the pre-cleanse to make sure that the product is completely removed from the skin. So I have those products right over here. So you're going to use either the Ultra Calming Cleanser or the pre-cleanse to remove your cleanse. So for this peel, I'm just going to go ahead and use the Ultra Calming Cleanser, but if it was a peel that was a thicker sensation, I would use the pre-cleanse because that's going to break it off of the face better than using the Ultra Calming Cleanser first. So just a little bit of water on your Ultra Calming Cleanser. I'm going to start the spreading motion. Then I'm going to get my cold towel or cool towel that was prepped with cool water, and that's been ready for me. So it's nice and cold, and I tell the client this is going to be a cool towel. Now this is going to feel good to them, but I also just tell them that it's going to be cold just so they're not shocked because they've been used to, say, warm towels earlier in the treatment. But this is very relieving to the skin. The cold towel is going to start pulling the heat off of the skin or from within the skin, and it's going to start to feel like that cooling sensation that the skin wants to feel right now. So I'm going to let this cool towel sit on the skin while I clean up my room a little bit with my old gauze and my my gloves and all that, and just make sure that I'm up to date there. So after we remove this peel, I'm going to tone the skin using the multi-active toner, and we would then go into a light facial massage. I could use my cold globes that I've showed you before to massage over the skin to, again, add more coolness into the skin. Whenever we're doing a facial peel and you see redness, or especially with the Jessner, you don't want to use warm towels afterwards. So from this point on in the facial, we're going to continue using either just like lukewarm or even cold towels, because that will feel a lot better than using towels that are from the hot towel cabbie. So you want to kind of change your protocol based upon what the person's skin is doing. So I'm now going to remove this towel. So this is going to be more of like a patting, an outward movement like this. You don't really want to do hard scrubbing, like, or a hard pressure, as that might feel a little bit irritating. But it can also feel good if the client's skin feels itchy, so there's that as well. But you want to kind of just do, at first, do this like kind of light absorption of the peel with the cold towel. Again, making sure to get around the nose, these little side areas of the nose, they will always be the areas that feel the most irritating to your client. So I just want to make sure to get my finger in there and just do a nice little round the nose removal. And next we'll do our multi-active toner. So I'm going to take my hand for the warning touch, and I'm going to spritz it around her skin on both sides. And then put more in my hand, and now really saturate this into her skin. And this is where you want to ask your client, how are you feeling?
Good, actually.
Good. So are there any areas that are still burning or feeling discomfort?
A little bit just around my nose area at the bottom, but that's about it.
Okay.
It's not bad though. Yeah, right there.
So you always want to not assume that your client is not feeling irritated or feeling still discomfort from the peel. So after I'm done putting on the toner like this, I say, how are you feeling, like I just did, and they'll inform you where they still feel some irritation, which is where I told you, which would be around the nose area. So that pretty much always happens. So you just want to take extra effort to remove product from that area and give that area attention, because the less your client has to inform you of an issue, the more relaxed and comfortable they feel. So I'm just using a little bit of water on my another 4x4 and tapping around the nose to make sure that that's completely removed. And I'm just going to go ahead and use another spritz all the way around her skin, just like that. So for today, I'm going to go ahead and just finish her Jessner Peel off with some moisturizer and sunscreen. Those are two very important products that people need to use on their skin after a peel. So very basic products after a facial or a facial peel are really important. You don't want to use any more retin-A or any more glycolic or any more ingredients that are going to be exfoliating, because that's going to feel extra irritating. So using products with less ingredients, like the Ultra Calming line, is going to be better for the person's skin after a peel compared to using something from the skin resurfacing line, like the magenta line. Okay, so I'm just going to go ahead and finish her up with those products, and I'll see you next time.